We are live now. With all your permission, I'm starting this session for today. Good evening, everyone present here. I am Faraz from IJCP Group. Welcome all the participants on today's webinar. Let's welcome today's speaker with great honor, none other than Dr. Sania Hasnain ma'am. And let me share some of the achievement of ma'am. Ma'am has done MBBS, MD in Hospital Administration and Technical Product Manager at Sales So. And she is going to speak on a topic Artificial Intelligence in Diagnostic. By taking not much time, I would like to invite ma'am and hand over this session to ma'am. Over to you ma'am, kindly proceed from here.
Uh, Hi, everybody, and good evening. And thank you so much for joining in. And I'm glad to be meeting some of you again this time. The topic for today's discussion would be recent advances in artificial intelligence in diagnostics. And my intention of bringing forward today's session is to enlighten all the doctors on, the new advances, the latest technology, and the developments that are going on in the field of diagnostics in healthcare. Before I begin, I would like to show you just something small.
Good evening, everyone. It is a pleasure to have you all join us today. As a doctor in digital health, I want to bring the knowledge about artificial intelligence and the latest technology to doctors. The landscape of healthcare will be more digitized, and AI will become a colleague bringing useful insights into patient care. As doctors, we must embrace the change, while at the same time being cautious of new advancements that come with their share of fallacies, ethical and legal issues.
The interesting part about this video is that this was not shot by me. This is not me speaking. This is an avatar of me that's spoken. I just wanted to bring forward the kind of technology that we have today that we can play around with. A lot of this is openly available to all of us to use. What I did was I took a couple of pictures of me, uploaded that, and then any script that I write would bring forward a video just as what you saw today. So that's just an example of
Good evening, everyone.
Technology that we have. Now, as a doctor in digital health, I want to, enlighten you more about the latest advancements. So let's begin looking at some of the recent advances in the field of diagnostics. To give you one example here, AI is being used in the early detection of diabetic retinopathy, which is a leading cause of blindness in adults. And in early stages, we are able to now detect the disease and prevent a loss of vision. Now, how is AI used in this? AI algorithms are trained on large data sets of retinal images labeled with different stages of diabetic retinopathy. These algorithms learn to identify subtle patterns and abnormalities in retinal images, allowing for early detection. How would this benefit the patients? Obviously, early detection enables timely treatment with simple interventions like laser therapy or injections, which can prevent vision loss in up to 90% of cases. It also reduces the healthcare cost. Obviously, early diagnosis and treatment are significantly cheaper in managing disease as compared to advanced surgeries and ongoing care. And lastly, it would obviously improve the quality of life. Early intervention helps patients maintain their vision and independence and preventing, depressions, other complications that come in. To quote one example, in 2020, the FDA approved the first AI-powered system for diabetic retinopathy detection called IDXDR. You can look this up online. The system has shown high accuracy in detection of diabetic retinopathy in retinal images, even in patients with mild and moderate disease. So that's about diabetic retinopathy. We also have this in India. We have, I will take you through an example later in my presentation. Let's take another example of where AI is helping with diagnosis. Now, this is an example of breast cancer detection. Now, in this case, analyzing mammograms. How is this used? Analyzing mammograms to detect breast cancer at an early stage, potentially even before any symptom appears. How is this being used? AI algorithms, just the way I explained in diabetic retinopathy, are trained on mammograms labeled with either benign or malignant findings. These algorithms analyze breast tissue patterns and identify suspicious features that may indicate cancer. Again, the obvious benefits: early diagnosis leads to higher cure rate and less extensive treatment options like lumpectomy instead of a mastectomy, reduces anxiety and stress in the patients, and improve personalization of treatment by identifying the specific type of cancer. AI can help guide surgeons and oncologists towards a more personalized form of care. An example of this being used in the world is deep learning models have achieved near human accuracy in breast cancer detection on mammogram, leading to several hospitals and clinics adopting a second reader alongside radiologists. This collaboration enhances the accuracy and patients' confidence in the diagnosis of the disease. Let's take a look at monitoring and treatment response in metastatic colorectal cancer. Let's look at how this is being used. AI algorithms now, in this case, analyze the circulating DNA levels in blood samples before and during the treatment. Now, changes in the DNA levels over time provides insights into how the tumor is responding to therapy, allowing for timely adjustment of the treatment. What's the benefit? Obviously, it would optimize treatment efficacy, enables oncologists to personalize plans based on the tumor's actual response. It reduces the treatment cost, avoids unnecessary rounds of ineffective therapy, minimizing side effects, and improving the overall quality of life for the patients. And lastly, it would improve the clinical research, provides valuable data for developing new and more effective targeted therapies. An example of this being used, the Foundation Medicine Liquid Tumor Test is used in clinical practice to monitor ctDNA levels in colorectal cancer patients. Studies have shown that this test can help predict treatment response and guide adjustment, leading to improved overall rate. Giving you another example of the benefit of AI in diagnosis, that's early detection of lung cancer recurrence. Detecting minimal residual disease in early stage lung cancer patients after surgery to monitor the recurrence of the disease. Now, again, how is this used? Similar to breast cancer, like I just explained, AI algorithms analyze circulating tumor DNA in blood samples taken after surgery. These algorithms identify specific genetic mutations associated with patient's tumor, enabling early detection of even minute amounts of cancer cells that may have remained after surgery. Early intervention allows for early treatment recurrence before they become clinically detectable. It also guides oncologists in tailoring treatment based on presence or absence of MRD, and obviously reduces the anxiety and the stress for patients. An example of this application on ground is the Garden Lunar Test. This is being used in clinical trials to evaluate its effectiveness in detecting MRD in lung cancer patients. Early results show the test can identify MRD with high accuracy, leading to early intervention and improved survival outcome. Give you some examples, some more examples here. Cure metrics, for instance, again, something that you can Google and see. This is a California-based company that has developed an algorithm for image analysis, which is currently being tested to identify lung cancer in X-rays and breast cancer detection in mammograms. Another example for all of you is a wearable technology. The Nevada-based startup has developed a breast patch to detect temperature changes in breast tissue, and the data is analyzed using machine learning algorithms. As you mentioned in our AI in the healthcare market, IBM, we've all heard of IBM Watson Back Pathway Genomics, has developed a blood test kit, Cerner Intercept Detect, and is currently collecting blood samples from high-risk individuals who have been diagnosed with cancer as a part of research study to determine if early diagnosis is possible. Another example is the startup that predicts insights and risk analytics to radiation oncology. Taking you through some more examples of the impact of AI in diagnosis. This is a simpler algorithm that hospitals use, and you'll come across various algorithms that help early detection and action. Here's an example of sepsis detection and risk stratification that is being used on ground. How is this used? Identifying patients at risk of developing sepsis, which is a life-threatening condition, within hours of arrival into the emergency department. AI algorithm, what it does is it analyzes a lot of data that would include vital signs, laboratory results, medical history, to identify subtle changes and patterns associated with early sepsis. These algorithms continuously monitor incoming data and issue alerts for patients at high risk. Now, with early detection, we would be able to enable rapid initiation of life-saving treatment for sepsis and obviously improve the survival rate, reduce unnecessary antibiotic, avoid any unnecessary antibiotic used in patients who are not at risk of sepsis, and improve the overall patient outcome. An example of this being used on ground is the early sepsis recognition tool, which is used in several hospitals in the US. It has shown an accuracy in identifying sepsis within 3 hours of arrival in the emergency department, leading to almost a 20% reduction in sepsis mortality. Another example, this is also something that we've seen. We've seen a lot of rapid test kits, but if we augment the outcome of any rapid test kit with AI, you would have more accurate results. It would increase the specificity and the sensitivity of these tests. Now, providing immediate HIV testing result at a community clinic or even individual homes of people. How is this being used? Smartphone connected device utilizes simple finger prick blood test and an AI algorithm to detect HIV antibodies within minutes. These devices display the result on a smartphone screen, provide immediate awareness of the disease status. How would this benefit? Increased testing rate improves access to HIV testing, especially in populations with low healthcare engagements. You would reach a mass community. It would also have faster linkage to care, enables immediate referral for treatment and prevention services, minimizing viral transmission and improving patient outcome. Empowerment and self-management, it allows patients to discreetly get tested, which is again a very important area of consideration in case of HIV, and receive results in real time, promoting informed decision and early intervention. An example of this being used on ground is the Aura Quick Advanced Rapid HIV-1 Antibody Test. This is a smartphone connected device cleared by the FDA for home use. Studies have shown its accuracy in detecting HIV with high sensitivity and specificity, offering a powerful tool for expanding access to HIV testing and promoting early intervention. To give you a little more information on Aura, the in-home HIV test. Now, clinical studies have shown that this test has an expected performance of approximately 92% for test sensitivity. This means that one false negative result would be expected out of every 12 results in HIV-infected individuals. The clinical study also shows that Aura Quick test has expected performance of 99.98% for test specificity. This means that one false positive would be expected out of every 5,000 test results in uninfected individuals. Giving you another instance of use of AI within the diagnostics area. This is chatbots that are being used to assist depression screening and support. We also see these around Alzheimer's, anxiety, a lot of other mental health related issues. Now, how is this being used? Identifying individuals at high risk of depression and by providing initial support and resources. There's a conversational AI in place that analyzes users' language patterns and responses to questions about mood, sleep, and other symptoms. The algorithm assesses the likelihood of depression and offers personalized feedback suggesting coping mechanism, self-help resources, and connection to mental health professionals is needed. Obvious benefit of such an intervention will be increased access to mental health support. The chatbot is available 24/7, offers confidential, non-judgmental support, especially in areas with limited access to mental health professionals. Early detection and intervention, obviously, the chatbot can identify individuals at risk and leads to better clinical outcomes, and also reduces the stigma and promotes help-seeking behavior among the individuals. To give you an example of this being used on ground, the Wobot chatbot uses AI to assess anxiety and depression symptoms and provides cognitive behavioral therapy techniques and emotional support to patients. A study showed Wobot was effective in reducing symptoms and improving well-being in users with mild to moderate depression. Giving you another example of the use of artificial intelligence in diagnostics. This is again something we've seen in clinical practice as well. Automated EKG interpretation to detect cardiac abnormalities. This would detect heart problems like arrhythmia, coronary artery disease, and heart failure. How is this being used today? Artificial intelligence algorithms, they are trained on massive amounts of data set that are labeled with different diagnoses. And then they can analyze complex pattern of electrical activity in the heart and would highlight and interpret abnormalities that sometimes the human eye would miss. The benefit of this would be improved accuracy and speed of diagnosis. It reduces misdiagnosis and delays, ensures prompt identification and treatment of life-threatening condition, obviously, and increases access to diagnosis. It enables accurate assessment even in areas with limited access to care. Reduces the workload of the healthcare professional, frees up cardiologists' time for complex cases, maximizing their expertise and efficiency. The more, as doctors, we are able to leverage AI on, addressing the simpler areas of care, the more time we would have free time to indulge in more complex decision-making, more complex care. An example of the EKG interpretation using AI algorithm is the cardiogram reader system by AliveCore, which is again an FDA-approved AI-powered tool that interprets single-lead EKG recorded on smartphones. Studies have shown a high level of accuracy in detecting atrial fibrillation and so on, and helping patients and obviously healthcare providers make better decisions. Another instance of AI being used in diagnostics is predicting stroke risk based on patient data and imaging factors. Now, how does this work? Predicting so what happens is you identify individuals at high risk of stroke before any symptom appears, allowing for preventive measures and early intervention. Again, in this case, the AI algorithm, they analyze a vast set of data that will include your medical records, imaging data, lifestyle factors to assess the individual's risk of getting a stroke. This information empowers patients and healthcare providers to implement preventive strategies and monitor for early signs of stroke event. The benefit in this case would be early identification of, again, a very high-risk individual, allowing for lifestyle modification, medication, and close monitoring. Improve resource allocation, obviously prioritizing preventive efforts for those who are at high risk, and being able to provide a personalized care approach. An example of this would be the GE Stroke Risk Prediction platform, which analyzes electronic health records and brain MRI scans to estimate an individual's risk of developing a stroke within 3 years. This information guides preventive strategies and close monitoring in individuals that are at high risk of stroke. Another instance of AI use in the diagnostics area is the rapid stroke triage and treatment initiation. So this is one step ahead of that. In this case, quickly and accurately, stroke can be identified. We can understand the subtypes in a CT scan or an MRI image, guiding immediate treatment decision and minimizing brain damage. This is again a very interesting use as we see. In this case, the AI algorithm, it analyzes various brain scans, identifies the subtle abnormalities, and differentiates between ischemic stroke, which is caused by blood clot, and hemorrhagic stroke, which is caused by bleeding. This information obviously helps determine the urgency and the type of treatment that would be given. Obvious benefit of this kind of a diagnosis would be faster treatment initiation. Time-sensitive intervention is obviously very crucial for stroke patients, and AI can significantly reduce the delay in starting appropriate treatment. Improved treatment outcome. Obviously, accurate diagnosis ensures patients receive more effective therapy for specific stroke type, minimizing chances of recovery, and obviously minimizing the disability, and reduces brain damage. Early intervention can limit infarct size and neurological complications associated with stroke. To give you all an example of where is this being used, Viz.ai Contact. This is a platform that uses AI to analyze brain scans and provides instant stroke type classification along with treatment recommendation. Studies have shown its accuracy in differentiating subtypes, leading to faster treatment initiation and better outcome for patients. Now, let's take a look at what's happening in India. I've been talking about technology. I've given you examples of these being used across the world. They are approved by the FDA and so on. Let's take a look at the use of AI within the diagnostics sector in India. Now, to give you an example here, a lot of you must have heard of Cure.ai, which is an Indian company. This automates the interpretation of X-rays, CT scans, and ultrasound scans, supporting faster diagnosis of lung cancer, brain abnormalities, and other conditions. Another example is DeepTech.ai, which offers AI-powered tools for radiologists, assisting with analysis of X-rays, CT scans, and MRIs. Zebra Medical Vision, again, another Indian company used by Apollo Hospital for COVID-19 detection and disease progression tracking. This is something that had come into play a couple of years ago. Even Max Healthcare, for instance, deployed an AI-based echocardiography for improved cardiac diagnosis. To give you some more examples of things that are happening within India, SigTuple. This is an AI which uses AI to analyze blood samples for anomalies identifying diseases like malaria and dengue. And we have CardioTrack, which employs AI to analyze ECG readings detecting heart health conditions. This was my first slide. So I mentioned diabetic retinopathy and the kind of work. Some of you must have heard of Forest. I have used this Forest Health, which leverages AI for diabetic retinopathy screening, assisting early detection and preventing vision loss. Niramai, this is again something I had used when I was in India. It employs AI for breast cancer screening through thermal imaging and offers a painless and accessible option to patients. Giving you some more examples of, and these are things that you would come across. These are areas that you would be using as doctors. You would come across these. Your patients would be using these directly in the form of apps and devices that are available at home. Or your own clinic, you may get some of these tools, or your hospitals may partner with these or different companies. I've just listed a few to give you examples of the kind of work that's happening within the diagnostic sector. And as doctors, it's important that, we engage with these, we learn how to use these, and we leverage them to our benefits. At the same time, being careful of some of the fallacies and biases that come with the use of technology. And I will discuss that subsequently. To give you some more examples of use of AI within diagnostics. So we've got Only Doc, which uses AI for symptom as a symptom checker and for preliminary diagnosis, guiding users to appropriate medical resources. We have Librate. Some of you must have heard that, provides virtual consultation with doctors, also leverages AI for initial symptom analysis and triage. Swast Guru. This is it offers an AI-powered health screening and assessment focusing on early detection of diseases. Then we have Eyesight, which is AI that analyzes fundus images for, again, diabetic retinopathy and other eye diseases, supporting early intervention. Path AI, for instance, here we have an AI algorithm for analyzing pathology images, assisting pathologists with cancer diagnosis and prognosis. SRL Diagnostics, again, something that we've heard commonly. We are aware of this company. It implements AI-powered blood cell analysis, improving accuracy and efficiency of hematology testing. Mantra Labs provides AI-powered decision support for dentists, analyzing X-ray and suggests treatment plans. Docternal employs AI to analyze sleep patterns. You see the vast array of use cases that we have within the diagnostics field, from diabetic retinopathy to your breast cancer, all kinds of cancer or recurrence of cancer, even in dental pathology and so on. Docternal employs AI to analyze sleep pattern and identify potential sleep disorder, promoting better sleep hygiene. Cognisure Technology here develops an AI-based solution for neurological disorder, assisting with diagnosis and treatment of conditions like Parkinson's disease. Health Clues. This offers AI-powered mental health chatbots, like I explained earlier, and screening tools providing accessible support for anxiety, depression, and various other mental health concerns. Artivatic AI analyzes medical records and claims data to predict patients' risk for specific disease and enabling proactive intervention. This is just to quote some examples of, so I've taken you through a lot of different areas where AI is being used in the field of diagnosis. Now, let's look at what is the benefit and what is the pitfall of such thing. As doctors, it's very important that, as technology advances, as the world is learning more, as we develop, we're able to leverage this technology. We are up to date. We keep up ourselves abreast with what is happening around. But at the same time, it's important that we are careful of the pitfalls that come with using this. Some of the obvious benefits that I've been showing you is the improved accuracy and speed of treatment and diagnosis and early detection of diseases with the help of AI. Again, another very important area, which is personalized medicine. We're moving away from one size fits all or standard treatment protocols, which we apply to everybody. That's something that's changing, and we would see this in another 10, 20 years. That personalized medicine, precision medicine, will become a more commonplace. Where treatment is not just standardized, but based on the information that we collect on a patient, we'll be able to give very precise advice. There are companies that are already using personalized care and precision medicine, etc., to give very specific advice on nutrition, lifestyle, especially. This has become common, and even medicine is another area that would start developing. So personalized medicine is going to be the future, in healthcare. Non-invasive and painless diagnosis, of course, because AI is the algorithms would be able to predict, and with time this technology will only become better. So the predictions would be better, the accuracy of your results of the diagnosis would get better without the need of any any invasive intervention. AI also helps in monitoring impact of the treatment. So as a doctor, when you start treatment, you have to wait for a couple of months. You will carry out certain tests and then, track whether your patient is doing well, or do you need to change the course of your treatment. But with AI, this monitoring would become better. You will also have real-time data on the overall health and, the health improvement of your patients. And of course, it would reduce healthcare costs, right? The earlier we detect a disease, the easier it is for us to intervene. Overall healthcare costs need come down, and this is a big burden for all the countries. The cost of healthcare. So if AI is able to reduce the cost, I think that's a significant and a very powerful advantage of this technology. Coming to the pitfalls of AI, what are the problems? At the moment, this is the technology is still new. Everybody's trying. I gave an example of the HIV kit. While of course the sensitivity and the specificity have improved over time, it's better than a simple rapid kit. But we still have a long way to go in improving results. So it's important to understand that sometimes these technology can give you inaccurate results. It's important to be guarded, to be careful, to always tally this with clinical symptoms. Use your clinical judgment, because you will be the guardrail. While AI is giving you results, it's giving you information, it's giving you advice, but you're the guardrail in place. You're the guard that would ensure that there's only accurate treatment and advice going to your patients. So it's important that we use this technology carefully right now till we see the technology develop and give better and better results. Another thing that's important as doctors is to be careful about the over-reliance on AI and obviously neglecting clinical judgment. Like I said, it's important to understand that technology has biases, technology has inaccurate results. These are problems that would happen. It's important that we use our clinical judgment and ensure that we're leveraging it, but we're being careful. Another example that you would see around AI, and this is something you would hear more and more, is the lack of transparency and explainability. You see, when I keep saying AI analyzes or AI algorithms, now this algorithm is not very well understood, and it's not easy to explain, and there's a lack of transparency in this algorithm. You have neural networks, which has multiple layers, okay, and every layer is analyzing data and is coming up with some, solution. So, there's an initial data that is put in, and then there is this analysis that goes on, and you have an output. Now this analysis that goes on is obviously is not very well understood. This is not a straight line algorithm. The beauty of AI is that it understands what it needs to do to be able to give you an accurate answer, but sometimes it would make that mistake. So at the moment, having that lack of transparency is a major pitfall. You don't know why, if it's making an error, why is it making an error? What is the cause? What can you do to fix it? So that's a known pitfall of this technology. And like I said, as healthcare professionals, it's very important that we're careful. Data privacy and security is again important. All your patients' data is now, most of it is digitized. It's available either within a hardware system or on cloud data. How this data is accessed by any third party? Is it being used for advertisement? Is it being used by an insurance company, and so on? I think these are very important areas that we need to be careful about. Even while you're working in a hospital, the hospital would take care of this. But as a doctor running your own individual clinic, you need to be aware of the privacy policies, the terms and conditions of any third party that you're using. See how your patient's data is being used by them. So this was not the case earlier. Everything was on paper. We didn't have to worry about this. But today, even if you're using a simple electronic health record, electronic medical record, you need to be aware of the privacy policy, the terms and conditions. You take your patient's consent, but how is that data being used by the third party? Who are they? How are they using it? Who are they sending it to? Are things that you need to be aware of as doctors. And the last thing is the human AI. Collaboration challenge. This is something that we all see, a lot of times hospitals implement a new technology and the doctors aren't trained, the healthcare, other professionals aren't trained, you don't have the time, it's increasing your workload, etc. So I think these are teething issues of a new technology coming in. They will get better with time, but again, it's important to understand that AI is like a colleague that supports you. It should not, if it gets implemented in your workplace, it should not increase your workload or increase your cognitive load. It needs to enhance your overall work outcome. So that should ideally be the benefit of AI. But again, these are some of the pitfalls that we would see improve in years to come. So how do we prepare for the use of AI? How do we brace ourselves? Here's to give you some insights. So as doctors, it's important that we're constantly learning and upskilling, and we stay informed, we develop digital literacy, and we focus on the human skills that AI cannot do, take up. Right, the cognition, the empathy, the communication, how to talk to a patient, how to communicate good and bad news, empathize. Clinical decision is something that AI would be able to support you with, very well. But it's the human skills that AI would not have in many years to come, actually. When I talk about staying informed now, actively learning about AI application in healthcare is important. Attend workshops, conferences, go through some online courses. There are a lot of interesting courses, simple courses. You have EDX and Coursera and a lot of other online resources available. You make use of them. A lot of them have free courses also available. Have a basic understanding of how the technology works, understand the capabilities and the limitations of different AI tools. When I'm talking about developing digital literacy, it's important to improve your understanding of how the data is being analyzed, how the algorithm works, get an overview of how AI operates in healthcare. This will equip you to collaborate effectively with AI systems and interpret the outcome better. Lastly, the important thing is to focus on human skills. Like I said, AI cannot replace the human touch in medicine. So hone your skills of communication, empathy, critical thinking, decision-making skills. These remain essential for patient care and for building trust. Next thing is become a healthcare innovator, right? It's always those who take the lead, will move forward and have the first mover advantage. So, you should see AI as a partner, not as a problem that's coming that, okay, this is new technology that I get burdened with. No, AI is here to stay. It will only develop, it will only get better. As doctors, it's important that we see it as a partner, we see it as a powerful tool. So view AI as a tool to empower your practice, not as a replacement. Focus on how it can enhance your diagnosis and treatment planning and patient interaction. Then, at the same time, what's important is to maintain clinical judgment. Remember that AI outputs are recommendations and not definitive diagnosis. Retain your clinical thinking, critical thinking, and clinical judgment to make the final decision for your patients. Lastly, advocate for responsible AI implementation. This is new technology. Be a part of the solution. Be a part where you are advocating for the correct and responsible implementation. Raise concerns and propose solutions where needed. Engage in discussions about ethical considerations and the potential biases in AI healthcare that comes in. Share your concerns with policymakers and raise awareness of the potential issues. Promote human oversight and transparency. I told you this is a big pitfall of AI. Advocate for clear guidelines and regulations regarding AI use in medicine. The EU has, that's Europe, has an AI guideline. Singapore has AI guidelines. A lot of countries are coming up with guidelines on where and how AI should be used and how do we overcome biases. I've told you about biases just to give you a little more insight into what a bias is and why it's harmful. For instance, the world, over the last many years, we've had bias against certain communities, certain category of people, and those biases that have been there in the in our world, because we as humans have had biases against certain communities, categories of people, and so on. That's the data that's around, and that's the data that's fed to AI. So AI also has the same biases and the same policies, and they might just be exaggerated. So we need to be very careful. We need to be aware of the biases and the wrongs that are around us, understanding that that's the same data that's being fed into AI, and they would make the same mistakes. So it's important we're aware of that. One golden rule about AI is garbage in is garbage out. So it's very important to understand the kind of data that's being used to develop your AI. If that data is not clean, it's not accurate, it has fallacies, then your output would also be inaccurate. Next thing is to promote human oversight and transparency, especially in healthcare, advocate for clear guidelines, like I mentioned. And lastly, focus on data privacy and security. This is a legal responsibility for each doctor. Any data breach would, you as doctors would also be liable. It's important to be aware, understand data privacy regulations and patient consent protocol concerning AI that is used in healthcare, and advocate for robust data security measures at any given point of time. That's all from my end. If you have any questions now, I'd be happy to take them.
Thank you so much, ma'am, for a wonderful presentation. I think this is really, really, really helpful to all the young generation, all the doctors who are coming with the new generation of MBBS. Ma'am, we have received some questions from the participant. If you allow, with all your permission, shall we take these questions?
Yes, please.
The first question we have received from Dr. Agarwal. He's asking what can be the future of role of telemedicine and AI together?
Right. That's an interesting question. So, and something that we tried to use, we also tried to build to some extent when, um, so when you're doing telemedicine, I think one of the powerful use of AI is around clinical decision support. That is, when I'm, talking to my patients, I have my screen, and it's taking up it's taking up clinical notes first thing. So it's taking down the history from or based on what the patient's saying, and it's analyzing that history to be able to give me a diagnosis, to help me arrive at a decision that, okay, this is the condition, this is the diagnosis, and and recommend treatment options for my patients. That's something that AI would one of the first uses. And in fact, we already have this being used. There are AI based telemedicine platform, and this becomes useful because a lot of junior doctors, or a lot of doctors who are not in a particular area of specialty, areas where there is lack of health professionals available. I think that's where these tools become very helpful. Just think about it. A young doctor, with a young doctor, when you finish your MBBS, you know the theory, you've done your internship, so there's probably 1 year worth of experience, not even 1 year, it's few months in every area, right? Surgery, medicine, etc. That's your experience. You may have seen limited diagnosis. Uh, this AI tool that's there can probably has data of millions of different diagnoses, right? So you realize the impact that it'll have when you're talking to a patient and you're collecting that the medical history. It's going to be able to give you a very accurate diagnosis and a very accurate recommendation and treatment, and also the investigations, etc., that you do. So I think that's especially like I said, younger doctors, etc. And that's where we've also tried to use. We try to build AI in telemedicine so that we don't need very highly skilled and very highly experienced specialist all the time for simpler diseases. We can have younger doctors, and they would also learn, right? At the same time, you're learning, so they would also learn faster, and they'd be able to create a larger impact. Otherwise, you'll keep referring your patients to senior doctors or specialists. So that's where AI and telemedicine become useful.
Thank you so much, ma'am, for sharing your insight on this question. I hope that this is received by the participant. Moving forward, we have another question by Dr. Shruti, and she's asking what is the role of ethical and legal implication of using CDSS in clinical practice particularly concerning patient privacy and liability?
Right. So, okay, that's a good question. CDSS, which is Clinical Decision Support System, a lot of, now what happens is your electronic medical record, electronic health records will come with AI that helps you with when as you're feeding your patient's data, it'll help you arrive at a diagnosis of what the disease is, give you a differential diagnosis. It will give you the treatment options that are available to the patient, and it will also give you the different investigations. So that's what clinical decision support means. Now, the legal and ethical considerations. The legal consideration here is any inaccuracy in results, right? So, like I said, technology is developing. There are chances that you may have inaccurate result. Be careful when you're using them. There is the legal liability uh, here will lie on the doctor. It does lie on the doctor at the end, and we are the ones with a license, right? So we are the ones who need to be very careful. I don't want to discourage you from using it. Like I said, these technology will get better. They're always there to help, but it's always important to be careful. So yes, there is a legal liability which is on the doctors. As doctors, I explained, right? Over reliance on AI, can be dangerous. Be careful. Use your clinical judgment. That's why we don't have AI giving treatment advice directly to patients. It has to go through a doctor, and that's where the doctor's clinical judgment comes in. So that's your legal responsibility. With respect to ethical, because of the biases, etc., that come in, I'll give you some example. For example, and this is from news articles and different articles that I've read. Um, there have been instances where, like, for example, AI would show that the Black community has a lesser chance of developing a cardiac disease as compared to the white. That's just because of the way data is. Well, in real, that's not the case, but because there's a bias in the world, the AI also comes with bias. That's an ethical issue. So if AI, of course, is being used in diagnosis, etc., but if you're using AI in your research, in population management, etc., and you're looking at different communities, and if you see that there are biases in the data, then that's the same bias that AI would have, and that's an ethical consideration that we need to have in place on how any bias is affecting or impacting a community. I'll give you an example of outside of healthcare. If you this was initially even YouTube or a lot of other applications where you would if somebody's speaking, your words would be written as subtitles, and these are auto-generated. Words spoken by men are more clearer and picked up by AI better than they are when it is a woman. And of course, these are again coming from biases because there's more data of men speaking, than women. This is just some examples of biases that are there. And like I said, it's important to educate yourself, be informed, learn about AI, learn about the pitfalls and the biases, and be aware of it when you're using this. And another example is if AI is going to discriminate between men and women, for instance, just imagine if a lady is trying to call 911 or any, emergency helpline, and there's AI algorithm which doesn't understand what the person's saying. These are problems that do come with AI, and like I said, we need to be aware of it. Talking about privacy and data security, like I mentioned, it is your responsibility. If you are taking a patient's consent, please be aware of the privacy policy, the terms and condition on how the data is being used before you put in your patient's data. So just having that one time, in awareness, see the kind of tools you're using, see where they are sharing the data, see what, when you're taking your patient's consent, if it is the consent form from the company, then see what is written there, go through it once just to be aware of how the data is being used. So these are few things as doctors. Yes, there is a liability. Yes, there's an ethical consideration. And yes, we need to be careful while using this. Do I avoid using it? No, I love using these technology. They really help make my work easy. I use ChatGPT, Gemini. I showed you that video in the beginning that I created. I use all of this. but I always make sure, I'm careful while using this.
Thank you so much, ma'am. You have shared really good insight on this question, ma'am. One more question is related to CDSS, and the question is from Dr. Subramaniam. He is asking, how can CDSS help in medication management, including drugs interactions, dosage adjustments, and adverse event monitoring?
Thank you for that question. I had, I had a session with some of the doctors, I think a few weeks ago. It was especially on CDSS, and it's there on YouTube if you want to have a look. But yeah, and I specifically delved on this point. So, how does CDSS help in medication management? CDSS is very powerful when it comes to medication management. You see, as a doctor, I mean, we've studied, our medical books. We A doctor in their entire lifetime probably comes across 500 to 1,000 different kinds of diagnosis, while there are millions of different conditions in the world, right? But let's say you're living in Pune or Bombay or Delhi. So that's the, that's your patient base, and that's the number of cases you come across, and that's your knowledge. But AI would have a lot more. It has the world level data that it can bring in and insights, right? So every information about drug interaction, how a drug has a synergy with another drug or reduces the efficacy of a drug, all of that data can be fed into a CDSS system. When you are giving a patient any kind of medicine, it'll be able to tell you that, hey, this medicine interacts with this medicine, do not do this, or do you still want to go ahead, right? It would give you that option to consciously decide that, yes, there's a drug interaction here, do I still want to go ahead? Or if a patient is being treated by multiple different doctors, going to different specialties, sometimes the same drug may be prescribed by two different medical specialists. And if everything is within a CDSS, then it'll tell you that, yes, this is already being prescribed, do you want to prescribe it again, or do you want to up the dose? Also with the dose, right? For example, I saw somebody make a mistake, they just added an extra zero by mistake while typing the dose of a drug. That's again something that a CDSS system can put in place. These are all automations that are available in the CDSS system to prevent any kind of adverse event. Another thing that would be is when you have a CDSS system and you have the patient data there, you would also know what their potential allergies are, what their tolerances are. If you have information on, their blood parameters, is the kidney function all right, is the liver function all right, etc. Based on that, it would also help you titrate the dose of the drug. It'll also tell you whether a patient is allergic to a certain drug, and, do you need to use that? And how much can you remember as a doctor? But if everything is there in a system, that information, then there's a lesser chances of you making a mistake. So yes, drug interactions, etc. Allergies is something that all of these basic things that cannot always be at the top of a doctor's mind, all the time. And why, when all of this is just simple data that can be in a system, and guides you. I think that's where AI and CDSS is useful in medication management. It also helps you track the progress. So from time to time, if you are carrying out different tests, and then there is AI algorithm, it'll be able to predict that, okay, what, your patient is probably doing well. Why don't you check, right? These are some insights that AI will be able to give you based on, it's probably seen data of, let's say, 2 million patients who have been given the same treatment, who are probably from the same community, who have the same age, same city, same diagnosis, and this is how their disease progresses. So AI will be able to tell you, hey, this is probably the expected thing for your patient. Do you want to check? These are the kind of insights you will get in terms of medication management, and of course, adverse reactions, etc., from a CDSS system.
Thank you so much, ma'am, for answering all the questions, ma'am. I hope you have done justice to this topic and make the generation aware of this AI tools, and which will be they become masters in coming time. And thank you so much once again, ma'am, for taking out your precious time and sharing your knowledge on this platform, ma'am. As there is no more question, ma'am, with all your permission, shall we conclude this session?
Sure, absolutely. And just one thing, I would love for you all to let me know if there are any areas that you would want me to talk about, any specific areas that you would want to learn. I specifically didn't get into the details of how AI works or the technology behind it. I wasn't sure how interested you would be. But if the audience is keen at any point on learning how AI works, etc., like I told you, digital and AI literacy is important. Please let me know. I'd love to spend some time on that. Right. And thank you so
Yeah.
much for joining in. It was nice.
Yeah, ma'am.
Thank you.
And it was like definitely we will take some different session with different topic in future also, ma'am. Till then, take care of yourself. It was really, really wonderful to have you, ma'am. It was so kind of you explained each of the things very politely and very explained really well, ma'am. I hope it
Thank
is
you.
very helpful to all the generations, ma'am, coming up.